Hi everyone, this is Dr. Akhtar. So I will talk about my first lecture, and I divided my first lecture into two sections. In the first part of the anterior and medial thigh lecture, I will talk about the general organization of the lower limb, bones and regions, and also I will talk about the superficial structures, superficial blood vessels, cutaneous nerves, and lymphatics. So let's start. So lower limbs are extensions from the trunk, and these are specialized to support our body weight, and also it helps in locomotion. This helps in locomotion, that is the ability to move from one place to another. And by this lower limb we can move from one place to another place by walking or running, whatever. And also it helps in maintaining the balance of our body during standing and walking position. When we stand, our body weight is transferred from the vertebral column from the vertebral column through the sacroiliac joint into the hip bones, and from the hip bones the body weight is transmitted through the hip joint into the femur. The femurs, when we stand at ease, the femurs are obliquely placed. See, the femurs are obliquely placed in anatomical position or when we stand, and the knees are closer because due to the obliquity of the femur, the knees are adjacent to each other, and the center of the gravity is passing in between the two knees. So our body weight is transmitted through the hip joint from the hip bones to the femur, and from the femur through the knee joint to the tibia. Tibia is the only leg bone which transmitted the body weight during a standing position into the bones of the foot. And when we stand in anatomical position or at ease, our foot, they are slightly apart from each other, and center of the gravity is in between the heels of the foot, and also our toes of the foot, those are facing laterally. For the purpose of description, we divided the lower limb into 6 regions. The regions of the lower limb is the gluteal region which overlies on the posterolateral aspect of the hip bone, and that consists of large gluteal muscles. And then the femoral region or the thigh region, and then the knee region, then leg, then ankle and foot. The gluteal region, it overlies on the posterior aspect of the hip bone or the posterior aspects of the pelvic girdle. It extends superiorly up to the iliac crest, and inferiorly it extends, or it is indicated by a fold of gluteal muscles or fold of skin that is called gluteal fold. That indicates the junction of the gluteal region and the posterior thigh. Gluteal region is actually a transitional zone between the trunk and the free lower limb. Anteriorly, the thigh region extends below the inguinal ligament. The thigh region includes the femur, the longest bone of the body, and the thigh region is continuous superiorly with the abdominal region, medially with the perineal region, and posteriorly it is continuous with the gluteal region. The thigh extends from the inguinal ligament up to the knee region. The knee joint is formed by the distal end of the femur. The distal end of the femur has 2 large condyles, the medial condyle and the lateral condyles of the femur, which articulates with the similar condyles of the tibia. And also there is another small sesamoid bone, the patella, which overlies on the distal end of the anterior aspect of the femur. These bones include, or they form, the knee joint. And posterior aspect of the knee joint has a hollow depression, like the cubital fossa in front of the elbow joint. the popliteal fossa is a region or depression behind the or posterior aspect of the knee joint. So this is called popliteal fossa, which lies on the posterior aspect of the knee joint, and it provides the blood vessels and nerves are passing from the thigh and going to enter into the leg. The leg is the region which lies in between the knee joint and the ankle joint. Sometimes the layperson, they called the whole lower limb as leg, but leg is this part of the lower limb which lies in between the knee joint and the ankle joint, and it includes two bones, medially the tibia, and the lateral bone of the leg is the fibula. The tibia, it articulates with the femur and forms the knee joint, and also it transmits the body weight from the femur to the ankle joint. Fibula does not participate in the formation of the knee joint, or it doesn't transmits any body weight from the femur to the distal part of the foot. It only provides the surface area for the attachments of the leg muscles. And distal to the leg, this is the foot. The foot, it consists of three sets of bones. Like the hand of the upper limb, it has the tarsal bone, it has metatarsal bones, and also it has phalanges. The tarsal, metatarsal, and phalanges, all these are the bones of the foot. The superior surface of the foot is called the dorsum of the foot, and the inferior or ground contacting surface of the foot is called the sole or plantar surface of the foot. The great toe is also called, great toe is the hallux. It is also called the hallux, like the pollex of the thumb. It is also called the hallux. The great toe has two phalanges, and the other toes has three phalanges in each. So there are 7 tarsal bones, 5 metatarsal bones, and 14 phalanges in the foot. Like the other parts of the body, the lower limb is covered by the skin, and underneath the skin there is superficial fascia. The superficial fascia contains variable amount of fat in different parts or different regions of the lower limb. The fat is more abundant in the thigh, and fat is less in the leg and the foot. Within the superficial fascia, there are also the cutaneous nerves. These cutaneous nerves are sensory nerves which supply the skin and superficial fascia. And also there are superficial veins. In the upper limb, you have seen the superficial veins like the cephalic, basilic, median cubital veins. There are 2 important superficial veins in the superficial fascia of the lower limb. Those are the great saphenous vein and the lesser saphenous vein, or a small saphenous vein. Also in the superficial fascia, there are lymphatics, the lymph nodes and lymphatic blood vessels in the superficial fascia. Underneath the superficial fascia, the deep fascia. The deep fascia of the lower limb is pretty strong. It is strong. It encloses the lower limb muscles like an elastic stocking. And this tough, strong, deep fascia of the lower limb, it encloses the muscles. It encloses the muscle, and it prevents the overexpansion of the muscle during the movements of the lower limb. And also it makes the muscle contraction more efficient and helps in maintaining the venous return of the lower limb. The deep fascia of the thigh is called fascia lata. And this fascia lata means broad, it sends intermuscular septum in between the muscles of the lower limb and divides the muscles of the lower limb into several compartments. So within the superficial fascia of the lower limb, there are 2 important superficial veins. There is great saphenous vein, and there is a small saphenous vein on the posterior aspect of the leg. The great saphenous vein arises from the medial side of the dorsal venous arch. I already mentioned that the superior surface of the foot is called the dorsum of the foot. On the dorsum of the foot, there is a venous arch which we call the dorsal venous arch. From the medial side, the continuation of the medial vein of the dorsal venous arch is the great saphenous vein. The great saphenous vein, it ascends in front of the medial malleolus or anterior to the medial malleolus. This relation is important. Great saphenous vein ascends anterior to the medial malleolus, and then it ascends through the medial side of the leg. Then it passes posterior to the medial condyle of the femur. It passes posterior to the medial condyle of the femur. Then it ascends through the medial side of the thigh. Great saphenous vein is the longest vein of our body. It is very long. Then it ascends through the medial side of the thigh. It goes all the way at the proximal part of the thigh, and under the inguinal ligament within the superficial fascia of the thigh, there is an opening which we call the saphenous opening. And the saphenous opening is an aperture or opening through which the great saphenous vein dives down or entering, and it terminates into the deep vein. The deep vein lies deep to the deep fascia, and the deep vein of the lower limb in the thigh is the femoral vein. So great saphenous vein is the superficial vein. It drains the skin and superficial fascia, and it terminates or it empties into the femoral vein, and at its termination it enters or it is passing through the saphenous opening. The small saphenous vein is another important superficial vein that arises as the continuation of the lateral side of the dorsal venous arch or the lateral marginal vein. The small saphenous vein, it passes posterior to the lateral malleolus. See, the medial malleolus is the medial prominence of the ankle, and anterior to the medial malleolus is the great saphenous vein is passing, and posterior to the lateral malleolus is the small saphenous vein. Then a small saphenous vein, it courses through the posterior aspect of the leg, and small saphenous vein, it pierces the deep fascia, superficial fascia and deep fascia, and it dives down in the popliteal fossa, and it empties into the popliteal vein within the popliteal fossa. The superficial and deep, the great saphenous vein and the small saphenous vein have numerous unnamed tributaries. All these are the unnamed tributaries, and they communicate with each other by these tributaries. And also there are some perforating veins. There are some perforating veins which connects or which are the communicating veins into the superficial and the deep veins. The perforating veins, they arises from the superficial vein, and they pierces the deep fascia of the lower limb, and they connect the superficial veins with the deep veins. These perforating veins are important for the venous return, and the venous return of the lower limb is controlled by the valves. This great saphenous and the small saphenous vein, they have numerous valves in it, and these valves helps in maintaining the venous return from the lower limb, which goes ultimately into the inferior vena cava. So and sometimes these valves become incompetent, and due to incompetency of these valves, the superficial veins of the lower limb, they become dilated or enlarged or engorged, and this condition is called varicose vein. Varicose vein is a common pathological condition in the lower limb. I told you that the great saphenous vein has numerous unnamed tributaries, but sometimes the tributaries of the proximal part of the thigh, they communicate with each other, and they form an accessory saphenous vein. Accessory saphenous vein, it courses parallel with the proximal part of this part of the great saphenous vein, which lies in the thigh. But the terminal part of the great saphenous vein under the inguinal ligament, see, here is the inguinal ligament, and here is the saphenous opening, which is an aperture within the deep fascia and superficial fascia of the lower limb. And At the saphenous opening, when the great saphenous vein terminates into the femoral vein, it receives 3 named tributaries. There are 3 named tributaries of the great saphenous vein. These are the superficial epigastric, coming from the inferior part of the anterior abdominal wall, superficial circumflex iliac, and superficial external pudendal. Superficial external pudendal, superficial epigastric, superficial circumflex iliac. These are the 3 named tributaries of the great saphenous vein. They enters into the great saphenous vein, and great saphenous vein carrying blood into the femoral vein, which is the deep vein. Great saphenous vein is commonly used for the coronary arterial bypass. Within the superficial fascia, also there are cutaneous nerves. There are several cutaneous nerves within the superficial fascia of the lower limb. But you can see here there are some important cutaneous nerves. These nerves are the sensory nerves which supply the skin and superficial fascia. The important cutaneous nerves in the lower limb are the lateral femoral cutaneous nerve, or the lateral cutaneous nerve of the thigh. There are some anterior cutaneous nerves are the branches of the femoral nerve. There are several anterior cutaneous branches you may see in the lab on the anterior side of the superficial fascia of the anterior side of the thigh. And there are some small cutaneous branch of the obturator nerve. And there is another important cutaneous nerve in the leg, on the medial side of the leg, is called the saphenous nerve. The saphenous nerve accompanies with the great saphenous vein. On the medial side of the leg, see the great saphenous vein, it accompanied by a cutaneous nerve, the saphenous nerve, which is a branch of the femoral nerve. This cutaneous nerve accompanied with the great saphenous vein, that's why we called it saphenous nerve. On the anterolateral side of the distal part of the leg, there is another important cutaneous nerve, that is the superficial fibular nerve. Superficial fibular nerve is one of the branch of the common fibular nerve. It pierces the deep fascia on the distal part of the anterolateral side of the leg, and then it gives rise the dorsal digital branches over the dorsum of the foot. And the deep fibular nerve, the digital branches of the deep fibular nerve, is piercing the deep fascia in between the first and second toe. And in between the first and second toe, this digital branch is the branch of the deep fibular nerve. These are the important cutaneous nerves on the anterior side of the lower limb. On the posterior aspect of the lower limb, surrounding the gluteal region, there are 3 sets of cluneal nerves. Clune means buttock, the gluteal region. And there are 3 sets of cluneal nerves. Those are the cutaneous nerves surrounding the gluteal region. The superior cluneal supply the upper part of the buttock. The medial cluneal nerves supply the medial part of the buttock, and inferior cluneal nerves supply the inferior part of the gluteal region. Inferior cluneal nerves are branches from posterior femoral cutaneous nerve. Posterior femoral cutaneous nerve is the longest cutaneous nerve of our body. It is a branch of the sacral plexus. I will show you the posterior femoral cutaneous nerve as a branch of the sacral plexus coming out through the greater sciatic foramen. Posterior cutaneous nerve lies deep to the deep fascia. Unlike the other cutaneous nerve, it lies deep to the deep fascia, but you can see here its terminal branches piercing the deep fascia and entering into the superficial fascia. And these terminal branches of the posterior femoral cutaneous nerve supply the skin over the posterior thigh and the popliteal fossa. On the posterior aspect of the leg, there is another important cutaneous nerve. We call this sural nerve. Sural nerve, sura means leg. Sural nerve accompanies with the small saphenous vein. So sural nerve accompanies with the small saphenous vein, and great saphenous vein is accompanied by the saphenous nerve in the leg. So this is a color-coded illustration. You can see the area of distribution of the cutaneous nerves. See the lateral femoral cutaneous nerve. which is one of the branch of the lumbar plexus. It enters into the thigh under the inguinal ligament at the anterior superior iliac spine, and then its branches supply the lateral side of the skin of the thigh. The anterior side of the skin of the thigh is supplied by the anterior cutaneous branches of the femoral nerve. You know that the lumbar plexus has a branch, the genitofemoral nerve. The femoral branch and genital branch of the genitofemoral nerve enters into the thigh. The femoral branch supply the most proximal part of the middle of the anterior thigh, and the genital branch supply mainly the labium majus or the scrotum and the medial part of the most medial part of the medial side of the thigh skin. And on the most medial side of the skin of the thigh, it receives its nerve supply or sensory supply from the cutaneous branch of the obturator nerve. And the leg, the medial side of the leg and medial side of the foot gets the sensory innervation from the saphenous nerve, which is a branch of the femoral nerve. And the posterior leg, the posterior aspect of the leg gets its nerve supply, cutaneous supply from the sural nerve. Posterolateral side of the leg and lateral side of the foot gets the nerve supply from the sural. So see, all these are the sural. It has a medial sural and lateral sural, but you can say the sural nerve supply, the posterolateral side of the leg and lateral side of the foot, and the medial side by the saphenous nerve. And the sole of the foot get the nerve supply, the cutaneous nerve supply from the medial and the lateral plantar nerve, which are the terminal branches of the tibial nerve. And the dorsum of the foot, I already mentioned that the superficial fibular nerve, which supply the skin of the lateral side of the distal part of the leg skin, and also it supplies the skin over the dorsum of the foot. See, the dorsum of the foot gets the cutaneous nerve supply from the superficial fibular nerve, except the skin in between the first and second toe. The web in between the first and second toe, this small area, is supplied by the digital branch of the deep fibular nerve. So deep fibular nerve supply in between the skin in between the first and second toe. Sometimes we call this flip-flop nerve because we put our flip-flop in between the first and second toe. So deep fibular nerve supply the skin here. This is the dermatome of the lower limb. You can see on the anterior aspect of the lower limb, the dermatomes are from the L1, L2, L3, L4, L5. Only a little bit part of the most lateral side is by the S1. So all this part of the lower limb, on anterior aspect of the lower limb, get the nerve supply. You know that most of the branches of the lumbar plexus. And this is the territory of the regional, the segmental innervation of the skin, L1, L2, L3, L4. L2, L3, L4 forms the femoral nerve. So femoral nerve give rise the anterior cutaneous branches, which supply this part of the skin area. So dermatomes means a specific segment or segmental part of the skin get the innervation from a specific segment of the spinal cord level. And this is correlated with the developmental origin of the skin from that specific part of the segment. So L1, L2, L3, L4, L5, this is the dermatome of the anterior side of the whole lower limb, and the posterior side of the lower limb, the dermatomes are the S1, S2, S3, the sacral, S1, S2, S3 in the gluteal region, and the S1 is on the lateral side of the thigh, lateral side of the leg, and lateral side of the foot. And the S2 is the medial side of the thigh, medial side of the leg, and medial side of the foot. And see, in the heel region, this is the L5. And the most medial part of the leg and the foot is by the L4. So these are the dermatomes of the lower limb. within the superficial fascia, there is also lymphatics, the lymph nodes and the lymphatic vessels. So you can see the skin and superficial fascia is removed here, but you can see the deep fascia. I mentioned that the deep fascia of the lower limb is very strong, and deep fascia of the thigh is called fascia lata, and deep fascia of the thigh is continuous with the deep fascia of the leg. Deep fascia of the leg is also called crural fascia. So fascia lata is the deep fascia of the thigh, and the crural fascia is the deep fascia of the leg, which are continuous. Crura means leg. And within the superficial fascia, there are lymphatic vessels, and there are mainly two groups of lymph node in the lower limb. The inguinal group of lymph nodes under the inguinal ligament in the inguinal region. Inguinal ligament is the junction between the abdomen and the lower limb. And inferior to the inguinal ligament, there are inguinal group of lymph nodes. There are several lymph nodes, and they are arranged into two groups. There is a horizontal group which lies parallel to the inguinal ligament, and there is a vertical group of superficial inguinal lymph nodes. They lie along, or they accompany, or they lie parallel to the terminal part of the great saphenous vein. So you will see there are large lymph nodes inferior to the inguinal ligament, and these superficial and deep inguinal lymph nodes, they receive the lymphatic vessels which are accompanied with the tributaries of the great saphenous vein. So see all these lymphatic vessels which accompanied with the tributaries of the great saphenous vein, they are draining into the superficial inguinal lymph nodes right here. And superficial inguinal lymph nodes are ultimately draining into the deep inguinal lymph nodes, which lies deep to the deep fascia along with the deep veins of the lower limb. And then ultimately from the deep inguinal lymph nodes, all the lymph are draining into the external iliac lymph nodes. External iliac lymph nodes are within the within the abdominal cavity along the external iliac vein. So superficial inguinal lymph node receives all these lymphatic vessels, then it goes into the deep inguinal lymph nodes, and then external iliac lymph nodes. On the posterior aspect within the popliteal fossa, there are also popliteal group of lymph nodes. Popliteal group of lymph nodes, they lie along with the popliteal veins, and they receive the lymphatic vessels. They receive the lymphatic vessels which accompanying with the tributaries of the small saphenous vein. And all this posterior aspect of the leg is drained by these lymphatic vessels, and they are draining into the popliteal lymph nodes. And ultimately, the popliteal lymph nodes, the lymphatic vessels are draining into the superficial inguinal lymph nodes, then into the deep inguinal lymph nodes. Ultimately, everything is going into the deep inguinal lymph nodes and the external iliac lymph nodes. The femur is the longest and heaviest bone of our body. It transmits the whole body weight from the hip bone to the tibia during standing and walking. When we stand or when we walk, it carries our whole body weight. The femur has a proximal end, it has a shaft, and it has a distal end. These are the important bony points or bony features which are related with anterior and medial thigh muscles. The proximal end of the femur has head, neck, and the two tubercles, two trochanters. Unlike the tubercles of the humerus, we call these trochanters. These are larger than tubercles. So the proximal end of the femur has head, neck, and the two trochanters, the greater trochanter and the lesser trochanter. The head of the femur is smooth, and it is covered by the articular cartilage, and head of the femur articulates with the acetabulum and form the hip joint. And the greater trochanter is the larger bony prominence on the upper and lateral aspect of the upper end of the femur. And the lesser trochanter is a small conical projection on the medial aspect at the junction of the upper end and the shaft of the femur. Anteriorly, the greater trochanter and lesser trochanter is connected by a bony line, which we call intertrochanteric line. Similarly, posteriorly, the greater trochanter and lesser trochanter is connected by a more prominent bony ridge or crest that is called intertrochanteric crest. So anteriorly, intertrochanteric line and posteriorly, intertrochanteric crest connects the greater and lesser trochanter of the femur. The shaft of the femur is smooth anteriorly and medially and laterally, but on the posterior aspect of the shaft of the femur, there is a longitudinal bony ridge or line which we called linea aspera. Linea aspera diverge medially and laterally on the distal end of the femur. The distal end of the femur has two condyles, the medial and lateral condyles, medial condyle and lateral condyle, which articulates with the medial and lateral condyle of the tibia and form the knee joint. Medial surface of the medial condyle has a conical bony projection which we called medial epicondyle. And the lateral surface of the lateral condyle has another bony projections, that is the lateral epicondyle. Superior to the medial epicondyle, see the superior to the medial epicondyle at the distal part of the medial side of the shaft of the femur, there is another bony prominence or projections. There is another bony point or projections that is called adductor tubercle. Adductor tubercle is important for the attachment of one of the adductor group of muscle. These are the important bony prominences, and there is another bony prominence on the superior aspect of the femur which we call the gluteal tuberosity, and a line, oblique line, which we call the pectinate line. So this is the proximal part of the thigh underneath the inguinal ligament. So the skin, superficial fascia, and also the fascia lata or the deep fascia is reflected from here. And you can see inferior aspect of the inguinal ligament, there is a subfascial triangular area. There is a subfascial triangular area which we called femoral triangle, bounded by the muscles. This is the femoral triangle. The femoral triangle is bounded. It is a triangular space underneath the inguinal ligament, and inguinal ligament forms the base of the triangle. So this is the base of the triangle. The medial boundary of the femoral triangle is from this muscle, that is the adductor longus, which is one of the muscle of the medial compartment of the thigh. And laterally, this muscle, the sartorius muscle, forms the lateral boundary of the femoral triangle. Adductor longus and sartorius, they are joined with each other and form the apex of the femoral triangle. So femoral triangle, see, is laterally sartorius, inguinal ligament, adductor longus, and this is the apex of the triangle. The contents of the femoral triangle from lateral to medial is the femoral nerve, femoral artery, femoral vein, and most medially the lymphatics. You can remember the contents of the femoral triangle by this mnemonic: nerve, artery, vein, lymphatics, navel. And the floor of the femoral triangle, see, in the floor of the femoral triangle, the lateral part of the floor of the femoral triangle is formed by iliopsoas muscle. Iliopsoas muscle is formed by the joint muscle. It is a joint muscle formed by the iliacus and psoas major muscle. And the medial part of the floor of the femoral triangle is formed by the pectineus muscle, which is another muscle in the junction of the anterior and medial thigh. And the roof of the femoral triangle is formed by the skin, superficial fascia, and the deep fascia. And the femoral vein is the deep vein, which receives the great saphenous vein. And in the deep vein, the deep venous thrombosis is a pathological condition, very common. When we sit for a long time, the deep venous thrombosis can occur inside the deep veins. So, inguinal ligament, you know that it is formed by the aponeurosis of the external oblique muscle, and it has its attachment to the anterior superior iliac spine and the pubic tubercle. And inguinal ligament, it lies in the junction of the abdomen and the thigh, and under this inguinal ligament, the blood vessels, nerve, and muscles are entering into the thigh from the abdominopelvic cavity. So see, the femoral nerve, femoral artery, femoral vein, all are entering into the thigh under this ligament. And the inguinal ligament, it maintains, or it helps in maintaining the position of all these blood vessels and nerve during the movement of the hip joint. And you can see here this muscle. So in the abdominal cavity, this is iliacus muscle, and here is the psoas major muscle. Iliacus and psoas major together, they join together and they form the iliopsoas muscle. And when they enters into the thigh under the inguinal ligament, we call them iliopsoas. But in the abdominal cavity, we call them separately iliacus and psoas major. Iliopsoas muscle is attaching into the lesser trochanter of the femur, and it forms the lateral part of the floor of the femoral triangle. So the femoral triangle contains the femoral nerve, artery, vein, and lymphatics. And see the proximal part of the femoral artery and vein. They are enclosed by a fascial sheath or covering that is called femoral sheath. Femoral sheath is formed by the prolongation of the fascia transversalis and the iliopsoas fascia from the abdominal cavity under the inguinal ligament, and it encloses the most proximal part of the femoral vessels, femoral artery and femoral vein. And inside the femoral sheath, there are septums which divide the femoral sheath into three compartments. The most lateral compartment of the femoral sheath contains the femoral artery. The intermediate compartment contains femoral vein, and the most medial compartment of the femoral sheath is conical, small and conical in shape, and that is called femoral canal. Femoral canal is the most medial compartment of the femoral sheath that contains lymph node and lymphatic vessels. So, important thing is that femoral nerve is not within the femoral sheath. Femoral nerve is lateral to the femoral sheath. The femoral canal has an opening towards the abdominal cavity. See, above the inguinal ligament, this is the abdominopelvic cavity. So femoral canal has an opening towards the abdominopelvic cavity that is called femoral ring. Femoral ring is in the living. It is closed by the extraperitoneal connective tissue and fat, but it is a weak area, and through this femoral ring and femoral canal, femoral hernia can occur, and femoral hernia is very common in the female. Femoral artery and femoral vein, they bisect the femoral triangle. They lie in the midline. They bisect the femoral triangle, and femoral artery is commonly used for the coronary angiogram or the cardioangiography. So that's all for my first section. So I will talk my second section soon.